Hi everyone, I'm Arne, founder of AcademicLabs. Welcome to this session. We have Mark Tillotson with us today. Can you tell us what we will learn today in this session? And also introduce yourself, of course.
Yeah, certainly. So I say today we're looking at how to extract more value from ClinicalTrials.gov. So in my case, I wanted to understand what are the potentially under-investigated diseases, and I'll walk you through how I did it, so you can see that if this or a similar approach could really work for a question that you're wrestling with. In terms of myself, my name is Mark. At the moment, I'm a freelance strategy consultant. I'm helping pharma and innovative medtech companies with therapy area strategy, pipeline and portfolio strategy, and commercialization.
Excellent, thank you, Mark. And before we go into the details on how you did this analysis, could you maybe start with sharing what's your goal? Why did you do this kind of analysis?
Yeah, certainly. So I gave a presentation back in June on herding in the pharmaceutical industry, and specifically the stock price impacts of going for sort of me too or fast follower drugs. So the question I could anticipate is, okay, well, if I don't want to follow somebody else and I want to do something innovative, where should I be looking? And one obvious place to look is where are the diseases where you've got a big disease burden, but you're not seeing a lot of companies doing trials in that space. So there is disease burden data. I was able to get some from the IHME, but basically that breaks down to 172 different disease codes, which is great. But then how can I map thousands of clinical trials into 172 different disease codes? I couldn't, but that's where your platform came in.
Yeah, glad to hear we could help with that. Could you walk us through so everyone can learn as well how they can do this kind of analysis? And thank you so much for sharing that, of course.
So you should be able to see the platform. This is basically the query that I used last time. So looking at everything up to phase 3, up to and including phase 3. So now I'm interested in just seeing, has anything changed over the last few months that kind of changes the interpretation. So we'll look at all of the trials from 2025. I'm interested in trials that companies are doing, because that's obviously really where the pharma and biotech investment is going. And I'm not interested in healthy volunteer studies. I want something that's kind of more aiming to work on the disease. So the really cool bit is then applying the row by row AI. We go in here. I want to extract insights on individual clinical trials. I want to use my entire data set, and this is the query. You'll see here what I'm asking the AI to do is to map in for each trial the indication into those 172 diseases. And you see, again, given the length of the list, this is something I couldn't have done myself. And I'm forcing the AI to pick one item from the list or print none if none of the items fits. So we're into the analysis preview where we can do a bit of QC. Obviously, I did the checking kind of more thoroughly last time, but here we can say, okay, this is being mapped into lung cancer. And yeah, if you look at clinical trial diseases and conditions, we're looking at small cell lung cancer. So again, I was very positively surprised last time out by how kind of reliable the mapping was. So we don't need to go into that now. With no further ado, let's hit download.
So just for context, how this works. So we use AI to analyze each clinical trial separately, answering the question, doing this mapping in this case. We can go even up to 20 questions you can ask to do extensive mappings. And as I just explained, it's already 350 of those clinical trials have already been processed. So it goes pretty fast to analyze a large data set of like 2,400 clinical trials. It takes somewhere between 30 seconds and a minute, more or less.
And that's the amazing thing for me, that I say something that would have taken probably days if you even were willing to do it. I say you can get done in less than a minute. It's remarkable.
All right, we just forwarded a little bit the recording, so you don't have to wait for these 20-30 seconds. So what's done, the analysis is now done with the AI, and now we create an export file, an Excel file, where you basically have all these 2,451 clinical trials extracted with their data points, including the companies behind it, the phase, recruiting status, etc., and more details on the clinical trials, but then also the mapped disease as per the question of Mark.
So if I open that, and what I will do is I'll just copy and paste that data into the Excel file I used last time. And then, so you can see, I say you get the simple Excel export with my question attached. I then obviously put that through some processing to combine it into the disease burden data.
So Mark, can you go back to the previous step? Yeah, the processing. So then basically if you combine it with this disease burden data, then on the left side you have the number of clinical trials for that disease or that cause name, basically. And in this way you could combine these two data sets, right?
Yeah, exactly. That I say, it's these 172 causes that were, as I say, and the granularity is so rich. You don't want to throw that away by aggregating everything to kind of 10, 12, 20 categories. But yeah, so to bring that in, you already have the kind of disease burden numbers, and then to be able to effectively just simply count if from your data the number of trials is incredibly powerful.
Okay, thank you.
Yeah. So then, I say, if we look at the chart, just to orient everybody, on the x-axis you can see the total disease burden, the disability adjusted life years. On the y-axis, the number of clinical trials. So obviously, you'd hope to see some kind of good relationship between them. And what we actually see is there are some maybe anomalies. You see endocrine, metabolic, blood and immune disorders, which would include many of the obesity trials. Clearly, that's a very big area of study at the moment. So even though the disability of just life years is lower, then that kind of comes up right at the top. Whereas over on the right-hand side, you're seeing some of the areas that have really huge kind of disease burden still, with that stroke, ischemic heart disease, neonatal disorders, where you're seeing then fewer clinical trials. So again, they'd be an area to look at it more closely. And I've kind of still got a zoomed in version of the charts where you can start to see again some of the cancers receive their serious diseases. They receive a lot of attention, and rightly so. But in line with the disease burden, you could see, okay, are there more opportunities in back pain, COPD, respiratory infections that might have been understudied recently? So I say that's really what I was looking to do, is to identify some of those kind of potential opportunities that really people could say, okay, well, if I don't want to follow the herd, then what might I want to look at instead? And yeah, thanks to Academic Labs for making it possible.
Well, thanks, Mark. It's really interesting analysis and how you combined the disease burden data you got from one place and then in a quick way just extracted these insights on all the clinical trials starting this year, or you could even do it for a period to see how things evolve. And by simply a few clicks, you could combine both to reveal really helpful insights. So very interesting approach. And well, if anyone else is interested in doing this kind of analysis, you can combine one data set you have with data you can extract custom via our AI in our platform, be it for clinical trials, but could be as well for patents, for publications, for grants, and so on. You can easily do that. We're there as well to support. So if you're already a user, happy to help you out on this. If you're not yet a user, you can try it for free. You can use the AI for free for the first day. So happy there to help you as well. So yeah, thank you, Mark, for coming into this session and sharing your learnings, sharing how you can benefit from these kind of approaches. I think it can be very helpful for many more people. So thanks so much for taking the time to share this with everyone.
A pleasure. Thanks, Anna.
All right. Thanks. Take care.
Thanks. Bye.